Now, this particular DVD was actually recorded during a live seminar. So you're going to hear us interacting with the participants of the seminar, and you'll see exactly what goes on in a live training environment. Critical thing with the Taylor glide is your thumb positions. So the line of action is actually going to be in the plane that's parallel to the supporting surface. You want to isolate the talus, so you're moving the talus through the ankle mortise in a posterior direction. If the foot dorsiflexes while you're doing this, that will be a clue that you're not in the right plane. Thumb in that position, adduct the foot, you'll find the lateral prominence of the talus, put your thumb on there. You see I'm lifting up my elbow, so my forearms and wrist and fingers are all in the same plane. And then what I'm going to do is just work the talus down and then coming back anteriorly. Okay, so I can tell you right now Belinda is restricted in the posterior movement. Thenar eminence, navicular. Forefoot inverted. Ready, take up the tension and then thrust. Is actually going to be your thenar eminence. The thenar eminence is, here's your thumb, base of the thumb, that bone that sticks out right there. If that's the navicular, slide your thenar eminence, so it's effectively bone-on-bone contact. It's going to be a firm contact point. If you're too distal, you'll actually be on the pad of your thumb and it'll be too soft. You'll end up using, the force will dissipate through the muscle compression. Laterally, the navicular is resting against the cuboid, and if you apply a thrust, the cuboid's going to stop you going any further. If you invert the foot, you'll notice that it actually plantarly and rotates in an inverted direction. It pulls the cuboid away from being hard up against the navicular. Because what's going to happen is the forearms, the application of force is going to be in this direction, so both hands are going to work towards each other. If your forearms are not in the same plane, the force is literally going to be dissipated in that direction. If they're in the same plane, the force is concentrated in the navicular cuboid articulation. This technique is a manipulation. So it's where you take it to resistance and then apply a thrust. So you want to have everything set up in the right direction. Okay, so if I thrust now, you'll see my forearms, the force is literally going to be going in this direction here and this direction here. So just it dissipates and you'll have a very inefficient application of force. Forearms right out. Okay, and then it's a matter of throw. So the bony prominence in that area there is the part that sits on top of the cuboid. So sometimes the cuboid can be adducted or inverted or everted excessively through its position of subluxation. See on the screen round and parallel your thumb and index finger. The leg is then going to come off the table and just hang loosely, and I'm going to place my hands between my knees, and then it's a thrust. So I place my contact point like so, fingers just extend the medial part of the foot, opposite hand is going to wrap around. Leg comes off the table, let the leg hang loose, so let it dangle, go on really dangle, good. Between the knees, great, so I'm going to compress and extend at the same time, like so. All right, so what I'm doing, I'm actually fully extending the knee back, and then what I'm doing is using a lateral force, going to push the knee laterally and medially. So knee's extended, I'm going to push laterally and watch what happens at the knee. Anyone see anything happen, move? Say no, because there was nothing, it didn't go anywhere. All right, that's good. Knees aren't supposed to go sideways. Okay, so that's what's happening when I apply lateral force. I apply medial force. Okay, see that movement? It's literally at the knee. His knee is hinged. Can you feel it? I can feel the tibia actually moving medially. So extending. If I do laterally, there's nothing. Medially. So extend. Contact the posterior aspect of the tibial condyle. To confirm that you're on the tibial condyle is actually through motion palpation. So what will happen is you'll put your hand or your fingers on the back of the knee, you will then just flex and extend the knee. The femur won't move, but you'll feel the tibia moving underneath. Go up, there it is. Okay. So once you've got that point, then you can just go straight into your setup position. And what's going to happen? A rapid extension of that wrist, and it goes like this.
That looks impressive.
Doesn't it? And it sounds fabulous. In position, 20 kilograms of pressure here. Just motion palpation, I can feel it moving. If I motion palpation, nothing, no bone movement underneath. There it is. Under pressure,